Well, tonight we are getting clarification on a reported case of monkeypox here in the Coastal Bend. The City-County Health District now calling it a probable case. It is where we begin our coverage tonight. Now, it was late last night when a spokesperson from Christus Spawn told 3 News that they had one patient, a man in his 20s, who had not reported any recent travel. That man had been treated at Christus Spawn Shoreline and released. According to the Public Health District, he tested positive on a PCR test for Orthopoxvirus. That's a group of viruses that includes monkeypox. That test will be sent to the Centers for Disease Control for further confirmation. In the state of Texas, new monkeypox numbers just coming out within the last hour or so. The state health department is reporting more than 1,400 cases. North Texas has the most with 642 of those, and that is up from 582 in the last report. The Houston region has the second most cases with 596. Here in South Texas, Public Health Region 11, which includes the Coastal Bend and the Valley, currently reporting 4 cases. Of those who have monkeypox, 97.6% are men and just over 99% are 18 or older. Well, there are some symptoms to look out for if you feel like you or maybe someone you know might have monkeypox. Those include fever, muscle aches, and exhaustion. But the telltale sign is a rash that can look like pimples and blisters. Doctors say it primarily spreads by skin-to-skin contact, but it can also be spread by touching clothing and bedding that were contaminated by an infected person. All of this, of course, generating a lot of questions from people concerning monkeypox. We took some of those questions to the Assistant Director of Public Health. Our Michael Gibson is here now with what he found out. Michael?
Now that we have a probable case of the virus, more are sure to follow, and people are going to want to know what they should do if they think they might have it. And if they do, then those who have been around them, will there be enough of the vaccine to treat them?
Each patient requires 2 doses of this particular vaccine. So, if you do on the max end, we would have 500 doses. On the low end, we will have 300 doses, depending on how much vaccine can get drawn out from the vial.
That was Dr. Dante Gonzalez, the Assistant Director for the City and County Health Department. He says they've only received 116 vials of the monkeypox vaccine. And Nueces County residents get first crack at the medicine over those from the surrounding area, according to Dr. Gonzalez.
The vaccines and the allocation that we were given is for Nueces County. So first, if somebody would come to us, we would talk to the state, we would talk to the region, and then we would go from there.
Of course, those who actually end up testing positive for the monkeypox virus don't get the vaccine. Dr. Gonzalez says only those who have come into direct contact with the victim within 4 to 14 days can get the vaccine. That's because the health department did not receive enough of the vaccine to give it out to just anyone.
If you notice that you have any lesions that are popping up that you don't know where they're coming from, you have no idea where they were, or if you notice somebody else that had lesions and then later on you notice that you started getting some lesions, that the recommendation always is to talk to your primary care provider.
Now, Dr. Gonzalez had much more to say about our probable first case of the virus, and coming up at 6, we will hear from him about why we didn't learn about the first case from the health department, but instead Christus Spawn Hospital. Mike?
All right, thank you, Mike.